All right, again, good evening and welcome to the Interviewing for Health Professions workshop sponsored by the Health Professions Advising Center at UCR. I'm Charlie Scruggs. I'm the director of HPAC and I'm also an advisor in the center. And we're going to spend some time going through the interview process for health professions programs, what that looks like, what that entails. Things that you need to know, things that you might want to work on, and then a plan moving forward for you. So purpose of the interview, as you can imagine, at this point of getting an interview, your primary application, if you've applied to MD schools, that's AMCAS, DO schools, that's ACOMAS, dental schools, that's ADSAS. The application service for each of those respective health professions, as well as others, is it's centralized. So they're getting all this really fantastic information, who you are, where you went to undergraduate studies, your major, the courses you took, the grades, letters of recommendation, all of these things that we will talk about in this workshop. But they've looked at your courses, your GPA, and your test scores, and now they want to get to know about you. And getting to know about you is, why are you interested in pursuing fill in the blank, becoming a nurse, becoming a physical therapist, becoming a genetic counselor, going into public health, going to medical school, and so forth. They want to learn a little bit about your life story, maybe what excites you about helping other people, what are some of your activities or extracurriculars that you've enjoyed or hobbies, what type of skills, interpersonal skills, professionalism, that type of thing, maturity. They basically want to understand who you were on your application. Is this who you are? They also want to know, do you understand about the field? So again, why do you want to be a dentist, pharmacist, physician? So all those things are blended into the interview. So we think it's important before you actually have an interview, and I would even back up and say before you actually apply to a specific school, to know a little bit about that institution, to know a little bit about that program, the size, the location, the mission, the faculty interest. Is there any special programs or opportunities about that school? So I'm going to break a little bit of this down. So size isn't always an issue with students. I don't think that that's been typically our number one issue of concern, because most health professions programs are fairly small. We're talking anywhere from 50 to maybe 200 people. Location does come up for our students here. Many of them do not want to leave California or Southern California. Some are okay to go anywhere across the map as long as they get in. Mission can be very important. With our medical school at UCR, they are very mission centric. They have a very specific mission of what they want to do, how they want to serve the community, and that mission really starts at who they admit to their medical school and grooming their applicants or acceptances and their students to help fulfill that mission moving forward, which for the UCR School of Medicine is twofold: serving the underserved and increasing the number of physicians in the Inland Empire, Coachella Valley, and in Imperial County. And then faculty. Sometimes students want to apply to a specific school because they know that this clinician or this researcher who's well known in certain areas, they're at that institution. For special programs, away rotations, so having the ability to go to other hospitals or maybe go outside the state or even international, that is something that's available at certain medical schools. Clinical sites and populations, so thinking about here like having the ability to be at a children's hospital or a veterans hospital or a burns clinic like Shriner's Burns Clinic. So there's a variety of different hospitals and sites and rotations that you may be able to have experience with depending on where that medical school is located. And some of these things, not always, but sometimes being in a bigger city often lends to more opportunities. And not always the case, but often. I mentioned a children's hospital, I mentioned a veterans hospital. Sometimes there are cancer clinics, think of like City of Hope. So if you were in the LA area or even in the Inland Empire area, all these things are fairly accessible. But if you are going to medical school in a very rural area, that may not be. So these are just some things to think about as you're looking at schools to apply to, and certainly before the interview, so you're able to be knowledgeable about those programs and opportunities before you arrive at interview day. So I think it's helpful for you to know who the interviewers are. These are the individuals that you will be coming into contact with or meeting with on the day of the interview. Sometimes we think they're all MDs or DOs. If you're in medical school or if you're interviewing at a dental school, they're all dentists. But most schools use a variety of folks from different areas, different backgrounds, so it's very diverse. So we're looking at different things, and that could be community members, could be alumni of the school, could be faculty, current faculty, could be clinicians, so physicians, dentists, pharmacists, nurses, could be current students, first and second year students often. And those I find sometimes can be really brutal because they just went through the experience. So it's very fresh. They very much remember what it was like for interview day. And so they're kind of your peer in that regard. And then other admissions or professional staff through like student affairs or the financial aid office. Generally at a professional, graduate or professional health program, when it comes to interviews, it's all hands on deck. So a lot of people take on cross roles. They're doing this and that. So it can be kind of fun. And you can learn about the school and the various pieces while you're there interviewing as well. So the types of interviews that happen, there are basically categorically three: blind, partially blind, and open. And so you can see here, what the definitions are of those three. I'll tell you that most interviews fall to being either a blind interview or what we call, again, partially blind. So the blind interview is where your interviewer has not seen anything in your application. And your partially blind is that they've probably seen your extracurriculars, maybe some of your essays. They may have seen your letters of recommendation, but they probably haven't seen the courses that you've taken, the grades that you earned, and your test score. And the reason for that is to eliminate some bias. So if somebody had a really strong GPA and a really strong test score, the average person would probably think, it's very common to say, oh, this person's a 4.0 student. They scored in the 90th percentile of the MCAT. They should absolutely go to medical school. Or this person had a bumpy road. I don't know if they can really, handle the challenges of being in a professional or graduate program. So the idea of having a more neutral, non-biased interview is to have an additional person, have that additional piece, that interviewer have a series of questions that they ask you. And so this is what we generally find in an interview. And we'll talk a little bit about the questions today and how that works. But generally, this person or people, it depends how many interviewers there are, they are making an evaluation of you based on your feedback or responses to the questions that you've been asked. And that can be really, I think, refreshing in a way, because you're not necessarily having to worry about, oh, did they see this on my transcript, or I need to explain this grade or that, if that's happened. Now, if you're a 4.0 student, you may say, I really wish they could see this. Either way, however you feel about that, or whatever side of the fence that you're on, I'll say this: you've made it to the interview. And so that's the only point that matters right now, is that you've made it to the interview and everything is on the table for you at this point. So 3 types of interviews: blind, partially blind, and then the third is open. And open is where they can access all of your information. We do find that here and there, but again, to be most fair and to eliminate most, if not all biased, if that's even possible, would be blind or partially blind. So generally, these are the types of interviews that schools offer. And oftentimes, if you are invited for an interview, they will tell you the format in which that interview will happen. Interview formats. So there are, again, three types of formats, just like we laid out the blind, partially blind, and open. There are, mirroring that, three types of formats that interviews often happen in. And that's a traditional interview, which most of us know what that is. That's an interview to get into school. That's almost like a job interview. They're asking you questions one-on-one. Why do you want to be a doctor? What interests you in medicine? Your typical interview as you would probably understand or expect it to be. And then there's something called the MMI interview. And this has been around for, in the United States for about a decade or so. And this is more of a structured, standardized time set of stations. It's usually anywhere from 8 to 10 interviews, mini interviews, that you go around to different stations, different areas, and you're asked a different question by a different person. So those questions, again, could be 8 to 10. They're usually timed anywhere from 6 to 8 minutes. And you're asked a question about an issue or a problem, or maybe you're asked to solve a puzzle or write a prompt. So there's a variety of different tasks they can ask for you to do. And again, this is, it's a way for them to, ask you more complex questions, ask you questions that maybe require some thought, like there's a part A, there's a part B, there's a part C. And these questions aren't necessarily related to science or anything that you might have had in college in terms of a course. They're more of like situational issues, problems, tasks that you would work out, and they would evaluate you based on your work in addressing those questions, problems, issues, tasks. And then the third, which is pretty unusual, which is called a group interview. And that's where there's a small group of interviewees and committee members that are all together. And you are being asked the same question as your peers, and you're all responding basically at the same time. So that's a format. Is probably out of the three here, the least commonly used, but there are schools that use it. We do see some DO schools, osteopathic medical schools, using the group format. Virtual interview. So this is a new thing for us. If you were to ask me last fall about virtual interviews, I would say it didn't exist or doesn't exist because it hadn't. So prior to the pandemic, schools did live, real in-person interviews. And that was brought some really cool things, allowing you to go to the campus and actually walk on the campus, see what it's like, and envision what it would be like to be a student there. If you were there for the afternoon or the day or maybe a weekend, you really sort of got to transpose yourself into that setting and envision what it would be like. The downside of that is oftentimes time, the cost of travel, flying, hotels, that type of thing. So there's definitely pluses and minuses. But for this year, we envision that interviews they are right now, it is interview season as we speak, and it's all virtual. So we are not finding that students are going to campus. I know there have been a few PA programs, physician assistant programs, that in the beginning were hesitant to do online virtual interviews, but I don't know of any students who actually went to a in-person PA interview. So for now, things are going to be done virtually. And some of these things are real time, they're live, and you're connecting with a school or a program just as we're connecting here if you're watching live. or it's asynchronous, which if you're watching a recorded video, like you will be after today from 5 to 6:30, then that's asynchronous. So that means you are recording and you are uploading that video and you are sending to that school or schools for reviewers to watch at a later time. So again, for this interview season, things are going to be virtual and they are not going to be in person, but that very well may change next year. And even moving forward, if you are a freshman or a sophomore, or you're thinking of applying down the road and interviewing, it may be a mix. It may be a mix of in-person versus virtual. I think now that we've had this experience, schools will probably look to both. If you've heard the term, once you open Pandora's box, or you let the worms out of the can, it's kind of hard to put that back in. And I think we'll probably find the same experience with virtual versus in-person interviews. I think there'll be both. What I will say is for this cycle, if you have a virtual interview, know that you are no less disadvantaged of getting in versus somebody who had an in-person interview last year. We just know that that's what we have to do due to the pandemic. So there are different platforms. Zoom is the most frequently used. That's what we're using right now. The AAMC, that's the Association for American Medical Colleges, that oversees the application for MD allopathic schools. They have something called VITA, which is their acronym for Video Interview Tool for Admissions. And in this, there are questions, 6 questions that are presented in prompts, and you will do a uploaded response. So you'll do a video, you'll upload that response, and you'll send that out. There's no in-person review or interviewer there. Something very familiar to that is called CASPER, which is it's a situational judgment test that that's used in a variety of different health professions. Medical schools, MD and DO, do use CASPER, as well as other programs, physical therapy, nursing, veterinary medicine, that type of thing. And again, like the AAMC's VITA, there's no human no human present for that. So you are taking the test and your results get sent off to the health professions program. And then there is school specific modalities, which means that they might just have their own way of doing something. It could be Zoom, it could be phone, it could be Skype, it could be FaceTime. So it's a way for them to kind of decide on how they want to do this. We find when things are very school specific and they're not using Casper or AMC, generally that's a smaller program. So when you have programs that are getting thousands of applications and they're having to sift through those and do interviews, maybe hundreds of interviews, schools tend to do something more streamlined to help with the process of reviewing so many applications and setting up interviews. It's pretty complex. So, all right, let's talk a little bit about preparing for the actual interview, or what we would have probably said interview day. So some of the sample questions that you will likely see, and these are really important because I find that small talk or getting to know you is really important. We sometimes dismiss those things. We say, well, I'm not going to focus so much on, me or my activities or my hobbies or my family or, things that I enjoy outside of class, because I need to talk about why I want to be a doctor or a pharmacist and that type of thing. Well, yes, I think it's important to talk about your health profession, and one could argue you've already done that. You've done that in your essays and your personal statement. And you may do that during this experience, but you have to remember or think about you being at the dentist or the doctor's office or getting a checkup. It's really important for the practitioner to kind of level the conversation. How are you? What did you do today? What are your plans after this visit? What's going on in life? That's a way to make somebody feel comfortable, they're going to open up, they're going to be less nervous. I find, and I share this often with my students, and maybe because I'm really, I pay attention to it, is when I go to the dentist, they always ask me, well, how have you been since you were here in, let's say last May? Did you take that trip to Europe? You were talking about going to Europe, or how is your family doing? Or we're gonna do this triathlon, and I secretly think they're taking notes. So as they're sitting behind me and asking these questions, they're like, "Oh, Charlie's going on a trip to Europe," and so that when I come back in, they're being very personable. Well, just like that, medical schools, dental schools, pharmacy schools, they want to know a little bit about you. So tell us a little bit about yourself. What do you do for fun? What are you excited about? These are really great questions that you can actually talk about yourself. And these are questions that I call, they're like easy hitters. So if you go into an interview and they say, Sam, tell us a little bit about yourself. And Sam kind of scratches his head and says, can I take a minute to think about that? That's probably not a good thing, because Sam should already be able to talk about himself. He should be able to talk about his activities and what he does for fun and that type of thing. It's your more difficult, your more challenging questions that you may need to think about and process and respond. But be ready to talk about you, to talk about, activities, talk about clubs and organizations, talk about things that you've read. Be able to talk about clubs and activities, memberships, awards that are on your application, just in case they've seen that. Be ready to talk a little bit about that and that process and what you learned or what was difficult about that. That's something, those are easy hitters because that's something that you've already told them in your application. Okay. So sample questions, traditional interview, um, why you want to be a doctor, to tell us about this school, why you applied about this to this school, that type of thing. All right. Let's talk about the specific area of the health professions interest you're into, or health interested in, or health professions in general. So we encourage students to be thoughtful in responding to this, to um, be really intrinsic, talk about, reflect back on experiences that you had. Some of the things that we have listed here, like to help people, or I've wanted to do this since I was a kid, those are probably not good answers, because where you are in your application, you're applying for a professional career position. You're applying to go to medical school or pharmacy school or dental school or podiatry school, all doctoral programs. And so they want you, because you're at least probably age 21 to whatever when you are applying, they want you to provide an answer based on personal or professional experiences that you've had. And um, they should be able to capture like what you learn. There should be substance, there should be a personal connection. You should be able to answer those questions in a way that's going to allow that interviewer or committee to know this person, Sam, has done his research and he knows the field of dentistry, the field of pharmacy, the field of being a podiatrist or a physical therapist, whatever the field is. He knows about that. And we know that he knows about that enough that this wasn't just an application in the dark. He's ready to take that next step. I want to talk a little bit about the multi-mini interview, also called the MMI. So I shared earlier that this has been around in the US for about 10 years, slightly longer. It's a Canadian interviewing model. If you Google MMI, you will find a fair amount of information about this interview model. You will find sample questions. It's easy to prepare for, and it's very challenging to prepare for at the same time. I say that it's somewhat easy because, again, as I shared earlier, you don't have to have a certain subject matter, or you don't have to have completed, a certain program or core curricula to be able to answer questions. but you do have to have, you have to have your mind in the right place. You need to be able to think through things fairly quickly. You need to be able to do sort of like mind grabs and grab onto something and be able to explain it. I sometimes say some of these questions are like peeling an onion. You peel the first layer, there's that second layer of the question, you talk through that or get through that, and you get down into the third layer. And what they're looking for here is they're looking to see that if you are able to take a dilemma, a situation, a policy, an issue, a problem, fill in the blank, and work through it. So in the field, if you think about healthcare, and you could apply this to many areas, education also being one, but you are dealing with problems. People are coming in because, generally speaking, most people are dealing with something, they're being reactive, they're not being proactive. If you are proactive in healthcare, that's wonderful. You do your 6-month visit to the dentist, you do your annual checkup with your doctor. That's great. But most people don't do that. They come in when something hurts or they're in serious trouble. And so, as a leader, as a provider, we're looking at how people can make decisions and solve problems and know how to ask questions in a very limited amount of time. So you'll see listed, there are 6 areas that I've mentioned briefly before: ethical dilemmas or questions about policy or social issues, interactions with a standardized or fake patient. So maybe talking to somebody who is a fake patient, you asking them questions, maybe you attempting to take a patient history. There are the standard interview questions like, why do you want to be a physician? Why did you apply to this medical school? What are you hoping to learn about the field of dentistry or pharmacy? There could be a task requiring the assistance of another applicant, or maybe working with the interviewer. Essay writing, so responding to a prompt that you're given based on either maybe an ethical situation or something about the field. And then a rest station, which can be really cool, especially if you've been doing this. Let's say you're on your 4th or 5th interview, you need a break. You'll get an 8 to 10 minute rest station, or 6 to 8 minutes. It depends on the structure of the interview, where you can kind of take a break, get some water, take a rest, let your mind relax for a couple of minutes, and then get back up and get going again. So that's kind of the structure of the MMI. Many schools in the US use this process. UCR School of Medicine is one of them that uses the MMI. So it is really helpful to understand this structure, not memorizing it, but understanding the process, the types of scenarios or questions you'll be asked, and then how to plan forward, that you know that you've prepared as best as you can. So the MMI measures the ability, your ability to like think, communicate, formulate ideas, problem solving, cultural competence, which is really important. You think about healthcare, you have to treat anybody who comes in the door, whether they look like you or not, they believe like you or not. You have an oath to take care of them. And as I said before, whether this is a good example or not, it's like peeling an onion, being able to the interview committee to see how you think, to see how you communicate, to see how you formulate ideas, how you problem solve. This is really important part of the process, and that's how this is structured, for that experience, for them to understand, are you ready to enter their school? So let's talk a little bit about some of the ethical questions. I find that the 5 pieces that we have on this screen are very commonly asked by students. And some of these are a little bit more straightforward than others. First is, with a lot of MMIs, there's often no one right answer. It's like if you think about being in an automobile and you're trying to get from point A to point B. You may take the same road every time, or you may decide to take side streets, right? Or you may go around because Waze said to do that. But you're going to get to location B your final destination, and you're good to go. So it's kind of the same thing here. It's not like solving a math problem per se, that the step by step by step has to be, in step for you to get the right answer. Not everything is always sequential. So it's really, how did you come up with this? What questions did you ask in the process? Did you have to rely on other people? Did you have to say, I don't know about this, but I know about that? Do I have to, resource out? That's what they're looking for. Identify underlying issues. So, showing that you're aware of various issues and multiple perspectives. And this comes out oftentimes in, diversity pieces. It comes out in, backgrounds. It comes out in race. It comes out in terms of socioeconomic background. So, knowing that when people come through your door, it's not like a one answer fits all. Being reflective and thoughtful, and you've probably done a little bit of this already in your application, but specific to the question that you're being asked or posed. And then being open-minded. A lot of, issues, we think we know how to solve them, and we very well may, but you have to also be mindful that you're working with a patient or a patient's family. And so you also have to take into to the account that you're working with somebody else. If you are working with with a standardized patient, or you are dealing with a prompt that involves a patient, make sure that you keep them first. Don't go into, well, when this happened to me or when this happened to my mom, unless that warrants that. Keep it on the situation that is being addressed and the information that you have in front of you. Make referrals as necessary. So one of the things that I think is really important for you to know, I have to tell myself this often. I think most people in leadership should tell themselves this, is that we don't all have the right answers, and when I was starting work after graduate school, one of my first supervisors told me, it's impossible to know all the answers. And if you allow yourself to ask other people that are knowledgeable in that area, you're always going to be going in the right direction. You should always rely on other people to, that where they have expertise in their wheelhouse, or getting multiple perspectives. So referring out. And that's a good thing to do. Again, you're not going to know everything, and that's not what this goal is in an interview session. And if you don't know about the topic, that's okay too. I tell students, and really anybody, share what you know. And if you don't know something, say, I'm not familiar with that, or I don't know about that, but I am going to look into it. I would be willing to look into it, or I'm absolutely going to research that. And what that means is that this person's going to take the initiative to move forward and learn more about the situation or this case. And that's generally a plus in any situation. All right, so let's talk a little bit about how do you prepare for some of these ethical questions. And I can think of a lot of ways to do this with this current pandemic. I think we can all fairly agree that there are people who have different answers to how we should approach this. And what I typically recommend is that you be familiar with current events uh, through reading periodicals, newspapers, news magazines, TV. We all have access to a variety of different channels, whether you are, a watcher of CNN or Fox or MSN or the BBC or, PBS. There's lots of opportunities for you to kind of like dip your finger or toe into those news outlets. And I think that's important so that you know what sort of mainstream America is listening to or watching. Can also, there's a variety of different medical journals. Many are free. There's, with a lot of the uh, news agencies, if you go onto their website, they have a tab for health and healthcare and just being knowledgeable about some of the bigger health issues in America or even globally. Right now, COVID is really kind of at the forefront as it should be. But in addition to that, knowing about obesity, about diabetes, about mental health, we are a society of many needs. And one of the things about being a future health professional is there's a lot of work, there's a lot that you're already doing, but there's a lot of continued need. And so schools are going to be looking for that for somebody who is aware of what's going on around them and how to address that in really every level of health professions. It doesn't matter if it's medicine, dentistry, pharmacy, optometry, genetic counseling, occupational therapy, audiology, it all goes into those areas. Online resources, social media platforms, life experience. Many of you are COPEL scholars or you are volunteering at another hospital like Loma Linda or your community hospital. You're scribes, you are EMTs, you're working as a medical assistant or you're working at a group home for adults or the elderly, or even in your own home, you have a family member who has a health issue, and maybe it's acute, which means it's temporary, or it's chronic. It's more permanent, longer lasting, and so having life experience is important as well, and being able to being able to really extract some feelings as a person, as a patient, as a family member, um, and being open-minded. So I think that's always really important because again, we don't choose who comes to us for care. In a health profession setting, you take a oath to take care of anybody and everybody who comes through your door. All right, so I want to take a moment to do a practice question. I have a couple of them. Here's one that I'm going to let you go through, and we'll take maybe 2 minutes for you to read this question. And then I want you to unmute yourself and have just a few minutes of discussion about what you think about this question and what you would do in this situation. So again, 2 minutes and we'll reconvene at 5:45. All right, so can we let's take a moment to talk a little bit about this question. Okay, so and feel free to if you want to unmute yourself, that's fine as well. That makes it a little bit easier to converse as a group. Does anybody want to share their thoughts? Just thinking if this was a real interview, how would you approach this? So I'm thinking I'll kind of help you out here. We don't really have a lot of information, enough information in the situation. So we know a little bit about the individual. We know that it's a female. We know that she's 18 years old, that she comes into the emergency room with a nosebleed. We know that you're acting as a physician and that you've stopped the bleeding. Um, there's an issue. According to this prompt, she's in a coma and is in desperate need of a transfusion. And a nurse finds in her belongings a signed card from her church refusing a blood transfusion under any circumstance.
Well, first of all, as a physician, wouldn't my job be to put her life over everything else because of the oath?
Okay. Yep. So that's a good response. Does anybody else want to talk about that?
I mean, like there is very important piece of information, which is her age. I'm not sure if this matters, but she's like 18. So I think she gets to decide, but I mean, she's in coma, so it's kind of confusing. But I would say, like, since she's like Jehovah Witness or something, and she's 18 years old, maybe we should respect this.
Okay. Anybody else?
I would say that, she was brought to the emergency room. Um, they stopped the bleeding, but she needed the transfusion. And so, as my job as a physician is, to tend to her life first. Um, the card in her purse, I don't think warrants me to make the decision not to give her the transfusion. That makes sense.
Okay. Great. Anybody else?
Also, another thing, if you don't mind. So I mean, like, there is another option, which is like we talk to her parents if they're there.
Yeah.
Is there any valid option?
Yeah, so this is really good feedback, and this is what you've all shared is something that I think would probably be very common responses. And I think we're sort of leaning the right way in terms of we probably need some more information here. We probably need to talk to either parents or relatives or somebody that knows her. This is a pretty serious situation. And do we deny a transfusion based on a card that maybe isn't dated? It isn't, does it really have legal standing? We don't know. But what we do know is that if we don't do something as a physician, if you don't do this transfusion, she could die, and that's not reversible. So in this situation, based on what you shared, I think probably we would reach out to, if it's possible, to family or somebody that knows her very quickly to follow up with questions. And then at the point of having to make a final decision, the physician's probably going to go through with doing a transfusion because it is taking care of the patient, which is your oath, your priority. And without having answers to some of the other really important questions, I would say that they would likely do the transfusion. But what I want you to also take away from this is that if you would have said no, but you were able to back it up with logical thoughts that made sense, that flow, that are, what we would say logical, logistic points, that's probably going to be accepted as well. So these are not trick questions. They're really, this is the situation. How would you go through this? You know, would you make the decision on your own? Would you reach out to other colleagues? Um, you know, I'm thinking about, and again, I don't want you to memorize this because I can't say this question is going to answer, but you know, it's like, okay, well, there's a bioethicist, medical ethicist at our hospital, and you could even just make this up, but I would call that person if I had access to them to, you know, get a little bit more information on what I should do in this situation. And medical ethicists, they do these types of situations. They work with physicians and other health providers and genetic counselors and people who are trying to figure out like life and right to die issues. So that's a sample question that you might find in an MMI. Right, let's do another one. So let's take 2 minutes, go through this question, and let's repeat the same experience as with the last one. All right, so what would we do in this situation based on if you were the emergency room physician at the local hospital, how would you address this situation? What would you do to take care of this individual? Let's say that this is your actual interview. So you're at your interview, you get this question, what would you say? How would you respond?
Well, if I notice that, he's not, well, if I notice there's no new injuries, and I've already told him politely that I'm not going to increase his dosage, if he, I wouldn't say threatens, but says he's going to go to a different doctor, I would try to talk to him and try to understand where he's at currently, maybe try to understand, get some more context where he's at in life. And based on that, I would have a better understanding of where he's at mentally. Maybe that would maybe allow me to you know understand maybe there's some addiction there going, or maybe he actually truly needs, and I should look further into his injuries.
Okay. Who else? Anyone else? So I think this is sadly the first example that we used, probably not as common as this. This sadly happens many times every day at hospitals and clinics. And this could very well be an issue that's brought up. It will definitely be an issue that you will see in medical school or during clinical rotations or even residency. And so, as sort of just mentioned, you know, talking to the patient, finding out, okay, there's no seemingly new injuries here. What's going on? Um, you know, is there anything that was overlooked originally or initially? And if not, you know, working with the patient to, um, you know, come up with other alternatives. And this might be where you also work with a seasoned physician or you know somebody in your team or in your area that understands addiction and what to do you know to help this person. It's likely that you know for many people there's an addiction there, and so uh, it's getting them into treatment not easily done. but being patient with the person, making them feel that they're heard, that they're listened to, that indeed nothing was missed previously, and giving that person the benefit, treating them humanely, and then upon conclusion of everything that you've done in that setting and that experience, letting them know, okay, well, we don't have any additional information that would warrant painkillers, so we're not able to do that. And whether they decide to go to another ER or not is really not your issue. I mean, there are things that you could do, by contacting other emergency rooms, but generally speaking, and you know this, if you've shadowed or you volunteered there, you're so busy, you don't have time. You just don't have time. There's so much else going on. But I think making sure the patient's taken care of, making sure they're heard, they feel valued, they feel listened to, asking them the questions that need to be asked, and then from there, letting them know resources, um, a variety of resources, whether it's from other alternative options of, taking care of pain, all the way up to maybe talking to them to see if they have an addiction. So again, this one's complicated because it's so common, so common. All right. So, focusing back out again on the interview is really just a great way for you to talk about things in your application or outside of your application. Your interviewer may ask you things. There may be stations that they ask you that has nothing to do with medical school or why you want to go to pharmacy school. And they may ask really deep questions about, if we go back to that last question, and maybe you said you were a scribe and you saw that. They may ask you about that experience or how that made you feel, or, what was sort of that follow-up response to that. I always tell students to be prepared to answer anything, especially if it's on your application. So if you wrote about being involved in AMSA or Presoma or the Future Dentist Club or Riverside Free Clinic, they can pick that apart however they wish. So be ready to think about that and respond to that. And anything that you don't know, if there's a question that you're like, okay, I should know this, but I need a moment. My mind is racing. I'm sweating. I need a moment. It's okay to say, I need a moment and respond. And then if you don't know, it's okay to say, I'm sorry, I don't know. If they ask you why you want to be a dentist and you're at a dental school, you can't use that, I don't know. That does not work there. But if it's a layered or more complex question, and you've thought about it and you truly don't know, it's fair to say, I don't know. But that doesn't generally happen. Again, these are not content-based questions. You're not trying to figure out a math problem or a science equation. It's a lot of this are things that they're situational, or what would you do in this cause and effect relationship. And as students that are almost finishing a baccalaureate degree, or if you have your degree and you're an alumnus, you should be able to answer most of these questions. All right, so let's talk about interview day, what that might look like. So as I shared earlier, interview day could be synchronous, which is live, it's happening just like this workshop is if you're participating right now, or it could be asynchronous. And so it could be something that you're recording and uploading. Nonetheless, they're both equally valuable. And we want to make sure that from the very beginning that you lay the foundation for a first impression. That sounds very general, and you may be shaking your head or rolling your eyes. Yes, I know that. You would not believe we get feedback in our office that students do not dress for the occasion. This is really important. So, make sure that you are wearing a suit, that you look your very best. One of the cool things, or one of the, I think, great things that you get away with is, let's say that jacket's a little bit too big, or those pants, are too snug, or they're a little bit big. No one's going to know. You are behind camera. So if the jacket's too big, you can use a clothespin to clip it in the back, or a chip clip. Nobody's going to know. Prior to this, we were telling students, make sure you try it on beforehand. You need to do that at least probably 3 to 4 weeks. That way, if it needs altered, you have time to do that. You don't necessarily have to do that now, as long as play it off that you've taken care of the suit as you need to. Less is more. So, shirt, tie, you don't need to have a lot of other things, no hats. You don't need to go overboard. Thankfully, most of us are in Southern California, so it's a little more temperate here. But I think it's really important to cover this. I'll be honest with you. I took this slide out a couple of years ago because I didn't think we needed to really talk a lot about dressing in business attire. And a few medical schools and other health profession schools followed up with us and said, we had some students from your school that weren't in interview attire. And we just wanted to let you know that. So that's where that slide came back in. So it is really important that you look your absolute best. Again, in this pandemic, there are some things that we're having to focus on that we haven't really had to before. Interviewing on your phone is probably not the best thing to do. Having some type of desktop, laptop, maybe even tablet. If it is a tablet, make sure that you have it anchored where you're not holding it. It's very distracting. I was watching an interview last night and the person held their iPhone the whole time, and I couldn't follow because I was getting motion sickness, and that's being really polite and true. So make sure that you have an environment and a device that you are happy with, and practice with that. As we're sitting here going through this workshop, or maybe you're standing up and doing yoga or stretching, or whatever you're doing, practice with the device that you're going to use during your interview. And I think that's important because if you're having to record yourself, or you're having to click on, click off, do chats, you want to make this as smooth as possible. You want to show, yes, I'm good with technology. Yes, I've practiced this. This is really well ironed out. And that allows for you to have your first impression be really smooth and strong. A stable internet connection is not always something that we can do, but it is really important. Some of the virtual tools that are designed for you to record, some of them, they will all let you start over, but some of them, once you get started, it's hard for you to go back or get back in. So it is important for you to have a stable internet connection and a private, quiet space where all your recording or all that's being picked up is your voice. So avoiding other people in your home. You've probably heard I have the windows open here, so you may have heard some cars going down the street. Those are things that you want to try to avoid. They affect your attention, and then also they're being picked up by your mic. And make sure that everything's plugged in and charged. Again, these are things you're probably rolling your eyes saying, I know that, but crazier things have happened. And again, that first impression is really important. And even though you are not going to campus and you're interviewing from home, that first impression is still holding true. So yes, we are in a pandemic, and yes, we are doing everything through tech, and yes, it can be exhausting, but yes, you still have to put your best effort forward. All right, so asking questions of the interviewers or of the staff or faculty that put on the event, that is really important because they are interviewing you, but you are also subsequently interviewing them. So when students, will ask me or ask our office, what are questions that I should ask? I flip it around and say things that you're interested in. So, if you have questions about how the course structure works, or how the labs work, just envision your collegiate experience now and when you got started in college. What are some things that you thought about or you wish you knew before you started? And those are oftentimes maybe the same questions or approach that you would have for a professional program. If there are things that have been answered or addressed on their website or presentation or a panel that you've just seen, or there's been Q&A, I would not ask questions about that unless they are clarifying questions. So don't ask something that's easily known on their website or that you've already received, because it sort of gives the idea that you're not paying attention. But if there are things that you do hear and you don't understand, or you have questions to clarify, absolutely fine. If the school is, because health profession schools are starting up all the time, if the school is what we call provisionally accredited, that means that they have accreditation to get started, but not full accreditation. They have to complete, basically graduate their first class and show board scores and that type of thing. So let's say that you're interviewing at a school that's provisionally accredited. It's okay to ask questions about that process. And again, likely there will be questions and answers, Q&A on their website. But what I want you to be careful about is don't go so deep down a rabbit hole that you are making that school out to be as if they will fail, because this has happened before. When I first started at UCR was provisionally accredited, and students were basically asking questions like, well, if you fail, what will I do? And you have to realize that people that are running the schools have worked at other medical schools and other health professions programs. So they do know what they're doing. It's okay to ask, like, what are some of the limitations? Are there any issues with that? Just be careful about going so deep that you're kind of setting a negative light, because they won't like that. And being mindful that, again, this is about you. It's a shared experience. They have questions for you. You have questions for them. And your goal should be, by the end of the interview, you have done your very best job to talk about yourself and respond to the questions that they have. But hopefully you also felt that you had an experience and you would know whether that school is good for you, would be right for you if you were offered an admission seat. So after the interview, after all is said and done, you should send them an email thanking them for their time. Oftentimes this goes to the Office of Admission or the person that contacted you to set up your interview. That person will see that other people receive that email. I would also, in that communication, if you have anything else that you want to share with them that you think is really important, put that in your email. I would also make sure that you sign your name, the name that you used in the application, as well as the ID number given to you by ACOMAS or AMCAS or FarmCAS, whatever application service that you applied through. Use that number, because you should know that, for example, our School of Medicine gets around 7,000, 7,500 applications a year. So there's oftentimes students with the same name who are applying. So it's just really easy for you to put that centralized application service number in that email, and it just shows that you're professional and you're organized. Beyond that, I would be careful about contacting schools frequently. Some schools even have policies about, after the interview, whether you can contact them or not. Some schools are very strict. They will say, after the interview, no more communication unless they reach out to you. And they're not trying to be mean or rude or cold. They just get so much communication. They try to be able to balance that oftentimes with a small staff. So anything that you share with them needs to be really important, like coursework, grades, something that they ask for and they're asking you to respond to. Those are things that you respond back via email. There are many resources for interviewing. There are lots that we share. Many of them are here as a part of this presentation. There are some that are on our website. So I would start with these. The AAMC is the Association of American Medical Colleges, and some of the documents and resources that they have are actually appropriate for all health professions. They're great preps for osteopathic schools, dental schools, pharmacy schools, audiology programs. By and large, a lot of health professions programs have the same process. They're looking at your academic component, your clinical component. How do you know that you want to be a health provider? And that's their interview process. And so they all have, for the most part, shared outcomes. of what they're hoping to get through from the interview. So there are some resources here that we think that's appropriate for you. I would say in addition to the national resources that you see on the left, schools, because of the vast ability of the internet, each school usually has an interviewing tips section, Q&A. There's YouTube videos that they put out, or students that have interviewed at their school has put out. So there's a lot of things out there. I would probably steer clear. Student Doctor Network is not one of my favorite things. And Reddit is not one of my favorite things. I know students do that. The reason that it's not my favorite, I think it creates a lot of anxiety. So I typically encourage you to stick with associations like the Health Professions Association resources links. Those are generally non-biased, and they're really putting out things that they think that you should be focusing on. You have our office, the Health Professions Advising Center. So we have 2 full-time advisors. We have a graduate student advisor who is part-time in our office. And then we have 16 ambassadors, such as Abby and Sam, who are on this session. So we're all here to support you through the interviewing process, through answering questions, or guiding you to where you can get the answers that you need. So here's our contact information. We are available by phone, our website. We have a lot of social media platforms. We've got Instagram, Twitter. We've got a YouTube channel. That's where this video will go from today's workshop. Facebook. So a lot of resources for you to take advantage of to help you in this next step. So with that, we have about 17, 18 minutes left. Questions. What questions do you have? Something I covered and I wasn't clear, or something that I didn't cover, or just questions in general? So I'm going to leave the recording on for another probably minute or so, and then I'll turn it off. And if you don't want to be recorded with your question, that's fine too. But is there anybody that wants to ask a question that doesn't mind if it's recorded?
Yeah, I don't mind actually.
Okay, go ahead.
Question about the UCR School of Medicine in general. And this is off topic from interviewing, but how many UCR students does the UCR School of Medicine usually take per year, considering their mission fit is to address the people, the medical concerns of the people in the Inland Empire? Um, Around what percentage of students are accepted into medical school that are UCR undergraduates or were undergraduates?
That's a good question. And there's actually 2 questions there. But Sam, do you want to respond regarding UCR? Do you want to take that first part?
Yeah. So actually, we were just actually talking about this, some of my peers and I, because I think they just had the EAP session. So there's kind of like 2 programs, I think. If I heard your question correctly, so they have like the Thomas Hyder and they have the EAP program, and those programs accept students who they have to be UCR students, and they look for students who are mission fit, so students who are who want to serve in the Inland Empire and contribute to eliminating the health disparities in inland Southern California. So with the Thomas Hyder, there's the Thomas Hyder, which is like the broad term for it, the Thomas Hyder program, and then within the Thomas Hyder program, there's an individualized program called the EAP. So altogether, they accept about 25 students who are just from UCR. And so they are in the students who, if you apply to the UCR School of Medicine and you're you're a UCR student, you get you're already considered in a separate pool just for those 25 spots. So if you apply and you're from UCR, you're in a separate pool with just UCR students. So they accept 25 people who are in that pool. And so yeah, 25 in general, and I think about this year it was 12 students of those 25 were EAP students. So yeah, it's about that 25, 30, kind of depends per year. But I hope that answers your question. I forgot the rest of your question.
That was great, Sam. And just to follow up on what Sam shared, the School of Medicine typically accepts around 77 students in their class. So out of the 24 or 25 from UCR, that leaves like 52, 53 students that come to UCR School of Medicine from other colleges and universities.
Oh, got it. Thank you. Yeah, that answered my question.
Okay.
Yeah, I was just wondering if they accepted students outside of that 25 UCR student threshold. You know, I don't know, maybe they thought, okay, I like this student, even though we've already accepted 24 or 25, maybe we'll accept 30 UCR students this year or something.
Well, to your point, yes. So historically, it's been 24. It's been 24 students, and this past year they accepted 25. So they did go above, albeit one person, they did go above that threshold that they had not before.
Got it. Well, thank you. Appreciate it.
You're welcome. Other questions? Let's see, there are some in the chat. So let me look at those.